The rules that need to be practiced after the discharge of the oncological patient. Module content. Module outcomes. Aim of the module. General rules. Which patient information is essential for the physician? What rules should be followed after the discharge from chemotherapy? What rules should be followed after the discharge from radiotherapy? What are the rules to be followed after the discharge from immunotherapy? What are the rules to be followed after the discharge from oncologic surgery? What rules should be followed after the discharge from being included in an oncology clinical trial? What rules should be followed during and after the patient's follow-up? What rules should be followed after the discharge from palliative oncological treatment? Support for patients and their families. References. At the end of the module, patients and their families know the important aspects of each step involved in the management of the oncological disease to better understand the complications that can occur during the treatment or after the patient discharge, for a correct approach over the treatment period and the follow-up. The basic aspects about oncology clinical trials, cancer patient follow-up, patient advocacy, seminars and guides, psychological support for cancer patients and their families. This module aims are to bring useful and practical information to cancer patients and their relatives regarding the rules to be followed after the discharge of the cancer patient. The module aims to provide, in particular, practical and theoretical information about the rules to be followed when discharging the cancer patient, after the first oncological consultation, after chemotherapy treatment, after the radiotherapy treatment, after oncological surgery, between palliative oncological treatment and palliative care. The objective of the module is to offer indications that are easy to follow and understand for a better care of oncological patients after their discharge from the hospital. Mode of administration, identification of adverse effects and drug interactions specific to each therapeutic class. General rules. After the discharge, the treatment plans and monitoring of cancer patients are multidisciplinary, elaborated by consulting the surgery, radiology, pathology, nuclear medicine, internal medicine, and radiation oncology departments. A close cooperation with a support and palliative team is ensured during treatment and in the surveillance period, which includes pain therapy, nutrition, and psychological support. The goal of these combined approaches is to obtain a complete remission of the disease. Together with specific approaches, lifestyle medicine evolves as a complementary practice to help individuals adopt healthy habits that can influence their health and quality of life, like smoking cessation, alcohol consumption limitation, improving diet and physical activity. Practicing complementary therapies such as stress management, yoga, meditation, and music therapy and acupuncture can be discussed with the oncologist. General rules. The first consultation for establishing the treatment represents the key point in choosing an individualized approach to treating the malignancy. The therapeutic scheme needs to be adapted to different characteristics of the patient, such as age and performance status, how the disease affects the patient's daily skills and activities, and an estimate of the treatment they can tolerate, in order to predict whether the patient will be able to handle the side effects of a complete or partial course of the treatment. The patient should ask the doctor whether he/she is considered fit for a complete course of treatment and whether the latest available therapeutics can be applied in his/her situation. Which patient information is essential for the physician? To conduct a personalized and safe therapeutic strategy, is the oncologist need to knows a complete medical history of the patient, a family history of cancer, a list with the ongoing treatments, a history of drug and food allergies and also the blood type, a history of metallic prosthesis such as metal plates, coronary stents. Nutrition. What rules should be followed after the discharge from chemotherapy? Patients should quantify the intensity and severity of nausea and vomiting, stomatitis, diarrhea, peripheral neuropathy, numbness, and all the other known side effects of their chemotherapy regimen which have been discussed before the administration, to better calculate dose adjustment and select the proper agents to counteract them. Patients should pay attention to the signs of early hypersensitivity reaction anaphylaxis, such as the early onset of skin rash, swelling of the tongue, throat and face, shortness of breath and dizziness, fatigue during or after the end of the chemotherapy perfusion. The patient should ask their doctor whether a special catheter is required for their veins, because strong cytotoxic agents can be irritant for small and medium caliber veins, causing vascular fragility and superficial vein thrombosis and fibrosis. Due care should be taken when the patient is discharged, since regular flushing of the catheter by a certified nurse is required to prevent clogging and bacterial colonization. What rules should be followed after the discharge from radiotherapy? Complications from radiotherapy may still occur early on in the treatment, acute, or months or even years after the end of treatment, chronic, especially when radiotherapy fails to completely spare the surrounding organs. As these complications may last for prolonged periods of time after the end of the treatment, they may be associated with disturbing symptoms such as long-lasting skin burn, diarrhea and urine incontinence, which require a specialized approach. Eggs and sperm are badly affected by chemotherapy and radiation therapy, while surgery of the gonads, reproductive organs, may be required in germ cell tumors. This implies that sperm banking, artificial insemination, and in vitro fertilization may be needed for couples wishing to preserve fertility. What rules should be followed after the discharge from immunotherapy? Immunotherapy, on the other hand, while being less aggressive to the progenitor cells of the bone marrow and having lesser toxicities than those seen in chemotherapy, can often associate autoimmune reactions of the liver, lung, thyroid, pituitary gland, or other organs, which can lead to severe pathology. This may require immunosuppressive treatment to prevent organ failure. This implies that any worsening of the patient's status over the course of the oncological treatment during before perfusion or in between two courses of chemotherapy or immunotherapy administrations should be notified to the oncologist. What rules should be followed after the discharge from oncologic surgery? Cancer surgeries are laborious and are often associated with significant blood loss, usually requiring blood transfusions during the procedure. This is why consent for blood transfusions will often be required before major surgery. Localized malignancies require surgery with wide surgical margins, while more advanced tumors require surgical removal of an entire anatomical segment of the affected organ, along with its blood and lymph drainage and adjacent lymph nodes, to limit the risk of incomplete resection and recurrence. Potential complications associated with lymphedema can be pain, discomfort, numbness, and increased risk of infection. These can be reduced by using elastic restraint, adopting anti-gravity positions, and performing a regular drainage massage in the affected area. What rules should be followed after the discharge from oncologic surgery? Women undergoing conservative surgery, partial removal, or radical, total removal, of the breast may choose to install a skin expander to facilitate further reconstruction, using a silicone breast prosthesis and areola tattoo, nipple area. Patients should be informed that governments in most developed countries reimburse these procedures to breast cancer patients. Tumors in cavitary organs such as those of the respiratory system, trachea, digestive system, stomach, guts, urinary system, bladder, urethra, bassinet, may require the installation of a temporary or permanent stoma. The tracheotomy is a small breathing tube inserted in the trachea to facilitate breathing while treatment is administered to a stenosing neck tumor, which may impair normal airflow. What rules should be followed after the discharge from being included in an oncology clinical trial? The gastrostomy is a small feeding tube inserted in the stomach to facilitate feeding while a stenosing esophageal tumor is being treated, which may prevent food passage to the stomach. The colostomy is an opening of the colon to the abdominal wall to ensure an emptying of the intestinal content into a collecting bag while a stenosing colon or rectal tumor is being treated. The nephrostomy is a small tube inserted into the renal bassinet to ensure the drainage of urine in a collection bag while a urinary bladder or urethral cancer is being treated. All these openings of cavitary organs to the exterior through the skin may pose an increased risk of infections from a disrupted and exposed skin and mucosal barrier, and due care is needed when handling them, while rigorous hand and local hygiene is required for any manipulation of their contents. Due care should be taken for not displacing or infecting the temporary lymph drainage tubes inserted after surgery, while newly created stomas may require handling from a certified nurse until they have properly healed. What rules should be followed after the discharge from being included in an oncology clinical trial? The clinical trials in oncology are designed to evaluate the efficacy and safety of a novel treatment or intervention in analogy with the current standard of care. The oncologist may refer the patient to be included in such a trial if he believes that a clinical benefit could be obtained from the participation to the trial. The participation in these trials is based on the informed consent of the patient, which may be withdrawn at any point. Patients, caregivers, and healthcare professionals can search for ongoing clinical trials based on patient characteristics at clinicaltrials.government. All key data from the study protocols are publicly available. What rules should be followed during and after the patient's follow-up? In case of remission of the disease, patients enter a follow-up period, in which regular visits to the oncologist are required, to assess the short and long-term effects of treatment and to assess the quality of response and the possibility of tumor recurrence. During the course of the follow-up period and after the end of it, the patients should implement a behavioral adaptation from a healthy lifestyle, avoiding tobacco, alcohol abuse, prolonged sun exposure, irregular sleeping and eating schedules, exhaustion and stress, while improving diet and physical activity when possible. What rules should be followed after the discharge from palliative oncological treatment? When the complications of cancer treatment outweigh the benefits in terms of quality of life, the patient will be referred to a palliative care unit where the best care will address the symptoms, to ensure the best comfort until the end of life. Support for patients and their families. Patient associations, seminars, and guidelines. Psychological support for cancer patients and their families.